Hello and welcome to the latest health and wellbeing webinar from the Asthma UK and British Lung Foundation partnership. For this series of webinars, we've reached out far and wide to find experts who kindly volunteered their time, and their aim is to help us to help you keep your mind, body and soul active during these strange times. Today, I'm delighted to introduce Vicky Wilson, who's running a self-action therapy session designed to help improve your health and mental well-being. Whether you have asthma or another lung condition, Vicky's session today should be suitable for everyone, as all it requires is a bit of brain power and some creativity. Vicky is a professional creative practitioner experienced in developing and delivering arts in health projects designed to improve the well-being of participants' everyday lives through museum touch therapeutic sessions. For many years, she's collaborated with a wide range of community groups and national organisations as part of her visual arts service, VisArt. The culmination of artworks created by individuals and groups were exhibited or performed in local and cultural venues across the UK, including at the London 2012 Olympic Torch Relay event. I really hope that you'll enjoy Vicky's session today, and here at the partnership, it's our hope that everyone who attends these webinars finds them fun and useful. Also, if you've missed any of our previous webinars, you can now find them all at asthma.org.uk/webinars. To make sure you don't miss out on any future webinars or the latest news from the partnership, please be sure to follow Asthma UK on Facebook or Twitter if you have asthma, or follow the British Lung Foundation on Facebook or Twitter if you have another lung condition. Now, before we go any further, as always, there are a few things I need to make you aware of. Just so you know, today's webinar has been pre-recorded. However, we do have a chat function enabled and we'd love you to say hello. Remember though, this is a family-friendly environment, so when chatting, do please be nice. The chat is of course moderated, but please be aware that our moderators have no medical training. However, if you or a loved one do need some medical advice, please remember you can always contact our expert helplines. For details on how to contact our friendly asthma nurses, please visit asthma.org.uk/helpline. And if you're affected by another lung condition, please do get in touch with the lovely team on the British Lung Foundation's helpline by visiting blf.org.uk/helpline. Also, if you miss anything today, don't worry, as you'll receive an email over the next day or so giving you the opportunity to replay today's session. I'd also like to take this chance to remind everyone that as a charity, the Asthma UK and British Lung Foundation partnership is committed to trying to keep everyone with a lung condition safe and well. But we can only do this with your support. So if you find this webinar useful, please consider donating just £5 after the session. Your support will help us to continue providing life-changing services for everyone with a lung condition. So, without further ado, let me hand you over to Vicky for today's webinar.
Hello, my name is Vicky. I'm a retired creative practitioner who provided an arts in health and wellbeing service across the UK in the development of high-quality visual arts activities to improve the individual's everyday lives. I'm an advocate for an all-inclusive, I-can-do attitude for people of all ages and abilities. With many of the award-winning projects I had the pleasure to put together were highlighted as good practice case studies at a local level and in the Arts and Health Conference domain as evidence of the benefits arts practices have on well-being. It's an amazing thing to be a part of. The culmination of artworks created in these projects also became a focal point for further discussion in the public realm through exhibitions at museums, performances at theatres and others in art galleries, both nationally and locally for everyone else to enjoy and just see the work that is carried on in all community groups without often being brought out into the public. I was forerunner of the now well recognised method of museum touch, which is a therapeutic practice designed for individuals to handle museum collections, to reflect upon and unlock their own experiences of life through this process. Once they've done that, I like to see how far we can bring out more emotions, reflecting on some of the things which were evoked, and take these through a process of making art. It's amazing to see how these things can develop. I think from initiation to idea and to the finished pieces can have a huge health implication, and the benefits to the individual are unstoppable, raising their spirits and literally physically changing their abilities to a heightened sense of self-worth. People who perhaps sat slouched changed their posture. They no longer sat slouched. They sat up. They walked taller. They were happier. And all through the processes of making art. I think at the moment, art has a wonderful place to play, facing some of the changes COVID-19 has brought to our doorstep, with lockdown restrictions, family crisis, being, I think, almost in a place where you can't always think clearly. So I can empathise with everyone out there who may be finding life a little bit difficult in these tough and difficult times. So I've put together a little project called My Pathway. Let me introduce you to My Pathway. It's a thought-provoking self-action therapy session for anyone who wants to explore ways to help improve their health and mental well-being, which is to be completed in one go or over several sessions. My Pathway is brought to you in 3 parts. A picture map, which has 6 different stations for you to consider and contemplation of change. A set of instructions, which takes you through a series of questions and action points for each of the stations. A set of tables for you to fill in words and use as a tool to work with the map. If you don't have access to a printer, then I suggest you copy the map template and write down directly onto it using the set of instructions to take you through the different stages. There are no right and wrong answers, just ones that mean something. So relax and have fun. I'll go through 1 or 2 of the stages with you. So a pathway is a route formed by a chain of nerve cells and impulses which control vocalization. So this is something that we're asking you to do here. So find your voice, tell your story. To start with, who are you? Are you young, old, single, married? What's your culture? Your likes and dislikes? Are you contented? Frustrated? And what are the important things that you have achieved so far in life and things of concern? Use the tables and write down some of the answers or write directly on your map. So we go to the reflection pool. Let's taking steps further forward. You're going to follow the path and you're going to maybe identify some of the things. So reflect on what makes you happy or sad. What are the triggers? What is it that triggers you? And say how they affect your emotions, and ask yourself if you think this is a good or bad place for you to be in. Try to be honest, as this exercise is an open narrative for you to explore some lifelong learning opportunities and new goals. What is it you want to achieve in life? Maybe here is some of the things that you can look at, and you can maybe say to yourself, I don't like this. I don't like what's happening. I think I want it to change. I think I want to be in a better place. And so we move on to the contemplation, the knockout camp. So for all of these stations, I think you need to set some time to one side to focus more clearly on the things that you have identified in the reflection pool, and make some lists of the things that you might want to change. Like we said, you might want to change just one thing or a small thing. You might want to change a lot of things all at once. But here's where you sit down, have a cup of tea. I've put you in a campsite. Seemed more fun. Think it through. Think about all the things that have been going on. Think about all the things that you might need to change. And then the thing you've got to do now is take those first steps. This is where you start reaching. You start reaching up, walking all the way up to the scary heights of the realization that, yes, I do want change. Yes, I want those changes to happen. So you need to prepare yourself both mentally and physically for some of those things to actually take place. So plan. Think of things to do. Think of all those people you might want to ask. And here's where you start putting things into action. Start the building blocks. Start thinking about who in my small community can I ask? Can I talk it through with somebody? You've come so far, and now it's time to look at how to make those changes, what help you might need along the way. It could be just small measures you can take yourself by changing habits, going out of the door and turning left instead of turning right. Then you'll change the places that you visit, or sharing with others. Find out who's in your community. Who is there? Who's behind all those doors, unlocking all those boxes that may help you? There's lots of them. Lots of staircases, lots of people you can ask. Sharing. Let them know how you're feeling, which can have a huge impact in your life. Here you need to make a list of who you think might help. And if you do not know, then maybe you could ask someone who does. A family member, a friend, go to an organisation or a local charity, for example. You can make forward plans now, actions. So put your challenges into practice. Here, make a list of all the things you identify at the scary heights and give yourself a realistic timetable to achieve your goals. Remember, some things may take longer than others, so just keep on working at it. Sometimes we fail, sometimes we have to stop, refresh ourselves, look back again and think about how we're going to work at it if it hasn't been as successful as we would have liked it to have been. Be positive and don't forget to have fun along the way. And when the tough gets going, always find someone else to talk to. But hey, go for it. This is where you want to be. These are the conditions. You've got to visualise all the things you want in life. Your aims and ambitions. Write them down for some time in the future as a continued management programme to make sure you realise your potential. It's all for you. And there's no failures. There's just positive thinking and rewards, you may find it a little bit more difficult to do all this in one go. So you may want to just look at one of the sections first. Where are you now? That may take some time to actually work out where you are now. Be reflective. Use the reflection pool. Be thoughtful. Contemplation. Think about what you want to get rid of. And don't forget, there's helping hands there for you, so you can use them. Be positive. Be strong. Don't be frightened of going up those scary heights, even if you are afraid of heights. Find somebody to help. And put those blocks into action. There you go. All the way up to the top for your rewards. And this is where you want to be. Well done. You made it.
Thank you so much, Vicky, for today's session. And thank you to all of you who joined us at home today. We really hope that you enjoyed today's webinar. Remember, if you'd like to repeat today's webinar so you can complete your My Pathways with Vicky's guidance, please keep your eyes peeled for an email over the next day or so, which will give you a link to replay the webinar. And please do remember that as a charity, the Asthma UK and British Lung Foundation partnership relies on the kind and generous support of people like you to enable us to continue providing our life-changing and sometimes life-saving services and advice for people with lung conditions. So please do think about making a small donation of just £5 to help us continue this vital work. Remember to visit asthma.org.uk/helpline or blf.org.uk/helpline for information on how you can contact our friendly helpline teams. I hope to see you all again at another webinar soon, so please do keep your eyes peeled for information about upcoming webinars. On behalf of myself and everyone here at Asthma UK and the British Lung Foundation partnership, stay safe, and I look forward to seeing you all again soon.